So I'm speaking to you from the Royal College of Surgeons, where I currently manage public patient involvement. And I suppose that's an approach to research where individuals are meaningfully and actively involved right across the research cycle. And this research that Niki will speak to you about ultimately stemmed from the meaningful involvement of children, of young people, of service managers and of leaders in Dun Laoghaire Rathdown, who helped us identify the critical gaps and needs with regards to youth mental health. And just to say a couple of words, if I could, about the Ppi Network, which is a national network involving 7 higher education institutions, including UCD and RCSI and NUIG and DCU and TCD. It also involves 10 national partners, including TUSLA and HSE, as well as 53 local partners and hundreds, if not thousands, of researchers at this stage. So it's a really big movement that is happening here in Ireland, and that we're leading at a European level to ensure that the voices of those most impacted by research are directly heard by the researchers. So PPI within the research cycle can take place at any stage of the research cycle, but the most powerful and potent point to engage with stakeholders impacted by our research is at that first stage of identifying the research gap or the research question and prioritizing the research. And that's the phase that we'll be speaking to today. In terms of the policy framework that underpins this project, it's the CIPSI is mandated into existence by a policy called Better Outcomes, Brighter Futures, which is the ex-Department of Children and Youth Affairs policy. And it speaks to 5 different key outcomes around children and young people being active and healthy, learning and development, safety, economic security, and participation in society. The structure of the CIPSI is that the county level CIPSI reports into the national CIPSI office, reports into the national steering group, who report into the Children and Young People's Policy Consortium, who then report into government. So that's another graphic, a little bit more complex, but you can see that there's a lot of structures and committees and personnel involved and related to any CIPSI. So essentially, a Children and Young People's Services Committee is all around interagency working, but what does that really mean? It means that we bring together multiple stakeholders to identify and address the needs of children and young people, to plan and coordinate services, to focus on evidence-informed planning, so really leveraging the evidence base and research to inform practice, and engaging in effective collaboration and ensuring that the resources are optimized for best use and that participation pervades all activity. The CIPSIs began back in 2007, and clusters of counties joined as capacity was built over the years, and Dun Laoghaire Rathdown was among the final tranche, and I joined in 2017 to support the development of the Dun Laoghaire Rathdown CIPSI. So for those of you not familiar with the area of Dun Laoghaire Rathdown, sometimes people who are external to the area consider Dun Laoghaire to be Dun Laoghaire Rathdown, but there is, of course, that big area also of Blackrock, of Stillorgan, of Dundrum, of Sandyford, Kilconnell, Glencullen. And part of the challenge as a researcher in looking at Dun Laoghaire Rathdown is that other structures, for example, the HSE use different geographical mapping delineations, and so they divide Dublin Southeast and Dun Laoghaire into what's known as the CHO6 area, or the Community Healthcare Organisation area, and TUSLA, who line manages the CIPSI structure, divides the area up into an integrated service area known as Dublin Southeast, or Wicklow. So the TUSLA area manager, Joanne Cullen, would have been the TUSLA area manager with responsibility for the Dun Laoghaire Rathdown CIPSI, as well as the Wicklow CIPSI. So the first thing that we did when we wanted to establish the CIPSI in Dun Laoghaire Rathdown is we commissioned some research to get good hard data around demography, economy, education, health and security, because that previously had not been collated for the area. And what we found is that around about a third of the population in Dun Laoghaire Rathdown are children and young people, defined as 0 to 17 and 17 to 24, or 18 to 24. So that's 70,000, around a third of the population. And I suppose that demographic mapping in the first instance was very useful because it showed us where are the population. So if you look at the dark blue spots, you can see that there's a concentration of babies and toddlers and preschoolers in some areas. That map changes slightly for the primary school aged. It changes quite significantly for the adolescent cohort, and it changes immensely for the young adult cohort. You can see there that dark blue area is all around the UCD area. So that is really helpful to us as service managers, as researchers, and as policymakers when we're looking to establish and plan interventions in terms of locale. And there's a range of other indicators that are contained in that initial baseline mapping report that are very useful. When we looked at the health indicators of the area, we did find a lot of quantitative indicators, which are all detailed. And with regards to mental health, some of those are useful in terms of we can see there's a rising rate of self-harm. We can see that the area has the highest rate of referrals to CAMHS. But it's not that useful in terms of what does that mean to the people, the children and young people and the people working with the children and young people there. So in order to unpack the story behind the statistics as such, we held a lot of participatory action research consultation sessions with a range of senior statutory community and youth leaders. The very first one, in fact, was supported by UCD, led by Professor Jason Last. And what we found was that the mental health gaps included the mental health of children and young people. And the strong recommendation came from that very first consultation that we should secure robust data on the mental health of the population, and that we should compare it to the Myworld survey. So it's wonderful to see Dr. Amanda Fitzgerald here today, and really looking forward to hearing her presentation shortly. We also consulted with educational leaders, and we heard directly from teachers and educators who have a very unique vantage point of witnessing large cohorts of children and young people move through their schools on an annual basis. And they said unequivocally that there is absolutely quite a significant rise in child and youth anxiety, in depression, and lack of self-regulation, and in lack of resiliency. So they were quite concerned about that, and we worked with them to establish work packages around social emotional learning, school withdrawal, and mental health difficulties. We also, of course, consulted with young people, including the young leaders in Corlin and Oak, who told us that from their perspective, depression and anxiety is an increasing and a big problem, and that they really wanted us to help them make children and young people more aware of existing mental health services. We consulted with young people directly in their youth space, who again told us that they would welcome advice from older people, that they really wanted us to encourage more dialogue and talking about mental health. And we held large participatory area consultations with young people through cross-care youth services to share our area research with them, and also, importantly, to hear their priorities. So over 60 young people voted overwhelmingly after, I think it might have been a 3 or 4 hour participatory session on a range of different topics. And the key priority for them was mental health workshops, information sessions on help seeking and advice. So in order to drive all of that, we needed to create robust interagency structures. And Dun Laoghaire Rathdown is very blessed and fortunate to have a number of very strong senior management leaders right across a range of services. And in this instance, the mental health subgroup was chaired by Aisling White, who's the principal psychologist in HSE Psychology Dublin South. And you can see there that all of the main players in terms of statutory organisations, community and voluntary organisations were there. And my apologies, there's a couple of organisations missing there, for example, Southside Women's Action Network, SWAN, as well as NEPS, the National Educational Psychological Services. So that centre piece there, the Lundy model around ensuring that we offer children and young people space and voice to tell us about their needs and their priorities, is of course enshrined in the UNCRC under Article 12, the right to express views. But the power of the CIPSI and the power of senior management structures and interagency structures like this health and mental health subgroup is that it provides young people and children with the audience who have the necessary influence to implement the recommendations and to plan priorities in a sustainable way, And of course, each CPSI subgroup talks to the other CPSI subgroups. So say, for example, the parenting support subgroup is chaired by Teresa O'Mahony, who is Aislinn's counterpart on the other side of the county in Dublin South East, HSE Psychology. And as the principal psychology manager there, Teresa would be very well networked with all of the services on that side of the county to ensure that whatever is decided is implemented and aligned in terms of services there and other subgroups there. So all of these subgroups, all of these consultations, all of these plans fed into what is known as the DLR CPSI plan, which is available online at cipsi.ie. And I think the importance that is placed on this interagency plan is reflected in the attendance of the CEO of TUSLA, Bernard Gloucester, and of the National Coordinator, Colman Nick-Lugda, and indeed of the Deputy Secretary General, John Cole, from the Department of Children and Youth Affairs at the launch. So really evidencing and demonstrating to children and young people, and indeed to services, that all of this work and energy is being listened to and does indeed feed up into national policy. And change. We then moved into our implementation phase. So we have, I think, over 35 different priorities, many of them related to mental health. So here's just a couple before we move on to the one most relevant to Niki's research. So one of them was around the desire to make mental health services more visible, more accessible, and more timely. So we had lots of meetings with children and young people and services to design an excellent website that I would really recommend people have a look at if they're not already familiar with it. It's called Let's Talk, DLR.ie. And what it uniquely did is it co-produced this with young people and invited their perspective, in particular on the design and how to access services and what language and concepts would they use if they're looking for supports. We also worked with a number of agencies, including Child and Adolescent Mental Health Services in St. John of God's, to develop an interagency support programme for young people who have withdrawn from school due to significant mental health difficulties. And onto the priority that's most relevant, again, to Niki's research, and this was the priority to collaborate on child and youth population health data. And so in order to achieve this, we worked closely with a number of key partners, including DLR County Council, the Local Community Development Committee, which is another interagency structure chaired by the council, with the Sports Partnership, with Southside Area Partnership, and indeed with HSE Healthy Ireland representatives to plan how would we identify the priorities for the Healthy Ireland funding stream, which the CPSI and the County Council have responsibility for implementing. So the process of commissioning the UCD youth mental health research via the Healthy Ireland funding was that the group of subgroup chairs on CPSIs agreed the funding priorities, which were absolutely aligned with the CPSI priorities. We assessed a very large volume of funding applications against these criteria. We shortlisted and invited further information. And then we worked with multiple organisations to process and award the grants. So although it's a relatively small grant in the bigger scheme of things, it has a lot of eyes on it. So it is a very significant and meaningful grant to be awarded. So warm congratulations to Niki and Clodagh on their successful award of that. We then developed a contract, a schedule, and we co-planned a recruitment strategy with the young people. And we were very excited because so many schools were enthused, as were youth organisations, and our expectation was that we would get a really robust, large sample that would tell us kind of definitively as to how young people in Dun Laoghaire Rathdown are doing. However, COVID hit, and this was almost 2 years ago at this stage. And so it's not like now where we're all quite used to working and communicating online. This really required a lot of innovation for Niki to pivot the project to be online and indeed to include questions related to COVID. And I think there was a lot of learning in that, and that the collaboration, even though it may not have resulted in the very large sample that we hoped for, it certainly supported UCD youth mental health research in terms of the funding, access to an evidence base, access to a range of gatekeeper organisations, access to the advisory youth group to pilot research instruments, to advise on recruitment methods. There certainly was letters of introductions and emails vouching for the researchers, and young people themselves got involved in promoting the survey via social media and planning dissemination. The collaboration also supported the goals of CIPSI in terms of empowering young people to make recommendations directly on the research tools, on the recruitment methods, and that their recommendations were clearly listened to and respected by the researchers. It offered young people the opportunity to exert their own agency to promote the research opportunity in their own communities, and it enabled partnership, which I think is so very critical, between service providers and academic researchers, because otherwise, as researchers, our reports are left gathering dust on shelves, and otherwise, as service providers who are so very busy in their daily work, it's very hard to access the evidence easily. So I think this partnership is really key, and I hope it's something that will continue to characterise the relationship between UCD and Dun Laoghaire Rathdown CIPSI. The robust data, of course, will inform the next county plan, and there will be collaboration on dissemination plans and further research opportunities. So that's it from me. I just wanted to kind of hop in and offer a little bit of context as to the importance, the value, the amount of people, the amount of stakeholders, the amount of hope that has been invested, that this research that Niki and the team have conducted will very much inform services, inform policy, and ensure that the planning and the collaboration that has characterised the Dun Laoghaire Rathdown CIPSI to date continues. Just a quick word, if researchers on the call are looking for websites to access data on, then the Outcomes for Children, the TUSLA website link that I've put up there, as well as the cipsi.ie website, are very helpful sources of information. So Niki, over to you. I hope that's a useful introduction to your research. Thank you.
Thank you very much, Lorna. That was really insightful, a very comprehensive context that you offered us there, and actually ties very nicely with the presentation of Your Youth Health Project. So just to remind people that Onya is just putting links, keep putting links in the chat box, so you can find all the links from our presentations in there. So I will just share my screen now. And okay, can you see that?
Yep, perfect, Niki.
Okay, thank you very much, Onya. So I will talk and present findings from the Your Youth Health Project, which aimed to explore young people's well-being, psychological well-being during the COVID-19 pandemic in Dun Laoghaire Rathdown. So a few words about me. I'm an assistant professor with the School of Psychology in University College Dublin, and I'm also the director of the UCD Resilience and Health Laboratory. My work focuses mainly on resilience, so I'm very interested in understanding the mechanisms underpinning resilience, especially in young people, children, adolescents, young adults, when they're exposed to different types of adversities, such as a global pandemic. So the Your Youth Health Project, So the Your Youth Health Project was aimed to explore, as I mentioned, the psychological well-being of young people during COVID-19. So in general, we collected data across the country, but today I will focus on the findings for the Dun Laoghaire Rathdown area. So the project was funded by Healthy Dun Laoghaire Rathdown and POBAL, and implemented through the Dun Laoghaire Children and Young People Services Committees, and supported by the Dun Laoghaire Rathdown County Council. So this is the team. These are the people. I would like to say a few words about the people behind this project, the people who worked together and brought this to life. So I'm the principal investigator, and I had the pleasure to work along with amazing collaborators and youth partners. So as you can see, youth partners were involved. We worked alongside with a number of youth partners, with a number of young people, and they were involved across all stages of the project. So design, implementation, analysis, and dissemination. And I would like to particularly highlight our collaboration with Cross-Care Youth Service in Dun Laoghaire Rathdown, who served as a youth advisory panel, and their input and insight, especially while designing the questions and the survey, was really, really invaluable. Before moving on and presenting findings of the project, I would like to give you a brief context about the situation emerged as a result of the global pandemic, as a result of the outbreak that was in back in March 2020, so almost 2 years ago. So during the first months of the pandemic, there was some evidence indicating that there are some mental health consequences on young people, on children, adolescents, and young adults. So what we did was that during the first 8 months, we brought together and synthesized evidence, international evidence on youth mental health, on the impact of the pandemic on young people. And what we actually did find out was that indeed up to November 2020, there was already evidence out there showing that there are serious negative consequences on youth mental health. And this evidence coming from countries across the world and bringing together over 2,000 participants. So this was kind of the context that we were working on and informed the conceptualization and design of this project. Back in March in 2020 and in the first few months of the pandemic, scholars and scientists and professionals and people working on youth health, they started, there were raised concerns about how this situation with the school closures and college closures will impact young people's lives. So indeed, because schools and colleges are settings that provide structure, are places of support, are places that young people go to be connected and interact and feel supported. So all these have been disrupted. And indeed, by May 2020, UN published a report and documented that 70% of youth mental health services were disrupted in these early months of the pandemic. And we have findings, evidence from a project conducted in the UK, where 25% of young people noted that they could not access support in 2021. And something that I would like to bring attention to is that what happened was that because young people couldn't spend time with their friends, couldn't get connected as they used to, this means that there was a reduced access to positive coping strategies. So we already know that how important peer networks and supportive networks are for young people. And as we were going through the pandemic and as we were doing more research, what we found, and this was coming from a study in adults, that resilience can actually mitigate and protect against the mental health difficulties induced or developed during the pandemic. And this was further corroborated later on by another study in adolescents, that indeed resilience may act as a protective agent against the mental health difficulties. This quote here is from a young individual, Mayhem, 18 years old, from the United Kingdom, and I think it very well captures the anxiety and uncertainty that young people might have been feeling and may still feel about the future. And this is related to that we didn't know what would happen. We didn't know where we were going, and we didn't know what the next steps are. So as Mayhem said, a lot of young people have been feeling like we are no longer in control of our future, which can understandably make us really anxious. And now I will talk about the methodology of the Your Youth Health Project. So as I mentioned, the project aimed to capture the mental health needs and mental health of young people across the country. But today I'm just focusing on findings from the Dun Laoghaire Rathdown area. So initially we met with the cross-care youth services from the Dun Laoghaire Rathdown, and who acted as our advisory panel, and we had who they contributed their insights about the topics and the priorities of that this survey should address. So after that, we sought ethical approval from UCD Human Research Ethics Committee, the Humanities Subgroup. And once this was obtained, we proceeded with data collection. So data collection took place entirely online due to restrictions from October 2020 until May 2021. So recruitment was indeed a challenge, and was conducted through schools, third-level institutions, youth clubs, and organizations. So all participants were asked to answer the same questions that covered sections on demographic information, COVID-19 related attitudes and knowledge, resilience, social support, depression, anxiety, and stress, and psychological distress specifically related to the impact of the event, that is the COVID-19 pandemic. And also we asked some questions about help seeking. This is the composition of our sample, always related to the Dun Laoghaire Rathdown area. So 112 young adults and 42 adolescents. So the total sample was 154 young people with a mean age of 19.5 years. And as you can see, most of young people were identified as female. In terms of education, this graph here reflects the composition of the sample. So most young people were enrolled at the time of completing the survey at the third level institution, while 24% were attending secondary education. 90% identified as Irish, and 84% reported that at the time of the data collection, they were living with parents or guardians. Now, the next set of slides covers some questions about COVID-19 knowledge and practices and attitudes. We ask young people about how you can catch COVID-19. And as you can see, the overwhelming majority identified that the transmission routes are either through droplets, through contact via contaminated objects, or through the air. We also ask young people about how satisfied they are with the amount of health information that was available about COVID-19. And as you can see, 87% responded that they were either satisfied or very satisfied with the amount of and availability of information. And we also ask young people how do they mainly get this information, and 82% responded that they mainly access this through the internet or social media, and then from family members, television, and friends. And I must note here that there were no significant differences between males or females, or between adolescents and young adults. The next question was about the level of worry. So we asked young people how worried they are about other family members getting COVID-19. And as you can see here, the yellow column shows that the total sample, that most young people were either very worried or somewhat worried that a family member can get the virus, can get infected. However, we did notice some differences. So young adults seem to be more worried than adolescents, more worried that a family member will get the virus. And this slide here presents aspects of mental health, so depression, anxiety, and stress. So we used the depression, anxiety and stress scale, the 21-item short form, which is a very widely used and standardized questionnaire that can capture depression, anxiety and stress symptoms. So I will unpack this slide. And as you can see, for anxiety and stress, the patterns are quite similar. Young people, around 20%, they fall under the moderate and severe and extremely severe end of the continuum, while less than half reported that they had reported experiencing normal anxiety and stress levels. What is, although is very interesting, is the depression scores. Well, the pattern here is, as you can see, is different. So a little less than 1/4 of our participants only reported that they were experiencing normal levels of depression, while 32% reported experiencing severe or extremely severe levels of depression, and 21 were classified under the moderate category of this continuum. In terms of psychological distress related to COVID-19, so we specifically measured the impact of the event, the psychological impact of the event. So we captured the post-traumatic stress symptoms that might be related to a traumatic event, and in that case, the event of reference was the pandemic. We used two different versions of the same scale, again, standardized scale, one for younger, appropriate for younger participants, and the other one appropriate for young adults. So this is an interesting pattern, as you can see in this graph. In terms of the younger participants, adolescents aged 12 to 16 years old, 75%, so 3/4 of our sample were classified under the normal rates, while together 26%, they reported either mild or moderate high levels. This pattern changes when we look at ages 17 to 25 years old, where 27% reported that they were under the severe end of the continuum in terms of the impact of the event. And we did find differences in terms of gender. So in general, females reported higher levels of psychological distress related to the event, both for the younger group and the older group. However, if I go back to the previous slide here, we did not find any significant differences for gender or differences in age group, which is very, very interesting. So we also ask young people about the frequency of alcohol consumption, and the key message of these two graphs is that there were no significant changes. There were no changes during the COVID-19 pandemic. So most young people reported that they either having the same amount or even fewer drinks during the pandemic, and there were no significant differences between males and females. And the next set of slides is about resilience and social support. So we measured resilience using the Children and Youth Resilience Measure Revised. So this is a scale that captures resilience as from a socio-ecological framework, which means that it assumes that resilience is influenced or is actually promoted through different interactions that are in the social ecologies of the individual, as well as it might be influenced by some personality traits, some personal trait, individual traits of the person. It captures a total score of resilience, but it also captures the personal resilience and the relational resilience, that is resilience that stems from connections with the community, the family, the school, the social environment in general. As we can see here, most people of our sample, most young people from our sample, they were either at the high or exceptional level of resilience score, and we can see that for the total and personal resilience, there are quite similar these percentages. And just to note, for the personal resilience, they were under the moderate level, while for the relational resilience, they were at the high and exceptional level. We found again no significant differences between males and females or between adolescents and young adults. The next slide presents social support from friends using a part of the multidimensional scale of perceived social support, a scale that has been very widely used to capture social support from different sources. And we ask young people for how supporting they think their network of friends are. As you can see here, overwhelmingly, most of our participants reported that they feel supported from their friends. And again, we did not find any differences between males or females or between adolescents and young adults. The next set of questions was about help seeking. So we asked young people, what places would you use to get information or support about your mental health? And there are two columns here, the yellow column showing places that I would use, and the orange column showing places I have used. And as you can see, friends and online TV and are the top choices of young people, places that they would use and places that they have used, and that is followed by a psychologist or a therapist. But here there is a discrepancy. Young people stated that they would use this source of support, but only 45% stated that they would use this source of support, but only 31% mentioned that they actually used that. Similar here for teacher guidance counselor and psychiatrists. For example, for teacher guidance counselors, 60% of young people mentioned that these would be places I would use, but only 8%, so half of them, these were places, mentioned these as places that they actually have used. And we also ask young people if they find these places useful. So as you can see here, towards this end of the graph, there is the blue color shows that they don't know, and that's really interesting about over half of participants for teachers, guidance counselors, psychiatrists, and for helpline, they answered don't know. And the yellow color shows that they did find very helpful places such as friend, parents, online, or TV. Now, the next set of slides presents a comparison between the two samples, so the Dun Laoghaire sample and the wider Irish sample. So overall, we collected data from over 1,000 young people across the Republic of Ireland. And in general, the demographic composition of the samples were very similar. So we collected data from 698 young adults and 157 adolescents, and there were no significant differences in age between the two samples or in gender. And again, most young people reported that they were Irish, identified as Irish. And in terms of education, we did find differences only in College of Further Education and university. So it seemed that more people from the Dun Laoghaire sample were enrolled in a university, while more people from the wider sample were enrolled in a College of Further Education. And also more people from the Dun Laoghaire sample were reported that they were employed at the time of data collection. Here is the question, a comparison of the question between the two samples. How worried are you about a family member? In general, what we did was that we calculated a mean score of worry levels, and we compared the two samples, and we found that the Dun Laoghaire sample were less worried than the wider sample in terms of a family member getting COVID, but the effect size was very small. That shows actually the strength of these differences, which means that there is no, maybe statistically there is a difference, but in the real life, we would consider this finding in the real life, in real world, possibly this difference is not substantial. Same for resilience. We see here that in general, the Dun Laoghaire samples displayed significantly higher levels of total resilience scores than the wider sample. But again, the effect size here, it's considered quite small. So these differences possibly are not substantial. We also find the same pattern with personal resilience, again with the Dun Laoghaire Rathdown sample displaying significantly high levels of personal resilience. However, we did not find any difference in relational resilience or social support. So there were no differences between the Dun Laoghaire sample and the wider Irish sample in the levels of perceived social support. And in terms of mental health, we found no significant differences in depression scores, stress scores, self-reported frequency of alcohol consumption, or psychological impact of the event. We did find, though, a significant difference in anxiety scores. The Dun Laoghaire sample reported lower overall anxiety score at the time of the data collection, and this tool, this scale, captures mental health scores, so anxiety, depression, scale, and stress in the preceding week of the time of the data collection. And we see here that the wider sample were 33% of the wider sample were under reported levels that can be classified under the severe or extremely severe end of the continuum, while that this is 70% only for the Dun Laoghaire sample. However, around less than half of participants from both samples reported normal levels of anxiety. Again, I have to highlight here the effect size, which was very small, that indicates that these differences might not be quite substantial. Now, in terms of the conclusion, so what we have learned from the Your Youth Health Project, and what can we consider as we go forward? So what we definitely have learned, and what these findings show, is that young people living in the Dun Laoghaire area have experienced psychological impact as the result of the COVID-19 pandemic. Similarly to young people living in other areas of the country, similarly to young people living across different countries around the world. Young people in our sample reported mental health difficulties that were especially linked and related to depression. However, this may not be necessarily linked to the pandemic. We have evidence showing that this crisis, this traumatic event, which was long-term and ongoing, may have exacerbated already existing mental health difficulties for some young people. And what we have also learned is that social support is really important for young people. Relationships with family, staying connected and feeling connected with the community is a really important aspect in young people's lives, and that might be related in fostering resilience. So what are the next steps? Where should we go from here? What are the implications for the future as we're going forward? So for me, this day marks the end of the Your Youth Health Project, a project that we have been working on for 2 years, and this is a moment of reflection as well. So I hope that we are now in the aftermath of this pandemic, and definitely I think that these findings may be a starting point in fostering discussions and maybe inform later decisions about mental health, the design of mental health supports for young people. However, to do that, what was very clear is that we need a very strong evidence base. So we definitely need to strengthen the pool of evidence we have of the mental health needs in the Dun Laoghaire Rathdown area. And we need to do that by conducting rigorous and robust research. And last but not least, it was really important to work alongside young people, to work alongside these amazing youth partners. And the truth is, we work with young people for young people, and that's one of the key aspects, a key feature of the Your Youth Health project. And also it was the synergistic nature of this project. So different people from different settings and contexts came together, brought different perspectives, and made this happen. So I think we do have to keep these 2 points in mind as we go forward in our effort to improve young people's lives. So thank you very much for your attention. I will stop sharing my screen now.
So I'm delighted to be here today to talk you through the Myworld survey research and to kind of contextualize some of the findings, particularly in a post-COVID world today. So today I'm going to provide an overview of, sorry, one sec. Oh yeah, I'm going to give a context to the Myworld survey, in particular looking at why should we focus on youth mental health, and then focus in on findings related to both adolescents and young adults, in line with Niki's research where they focused and included both adolescents and young adults in the research. One key feature of the Myworld survey is that we did our first piece of research back in 2012, and our more recent report was published in 2019. So as a result of that, using matched samples, we can look to see have there been increases or decreases or stability in some of the key indicators of mental health. So I'm going to talk through some of those changes from Myworld survey 1 to 2, and then outline some of the implications of the findings that are important in the context of informing practice and policy. So when we think about the health of young people, we know that their mental health is the #1 health issue. And this graph here shows the burden of disease across the lifespan. And we see here that the main contributors to disease burden late in life are neurological difficulties, cardiovascular problems, and so on. But if we look at young people here from 15 to 25 years of age, the 2 lines in the center, we see that the main contributor to the burden of disease in young people is accounted for by mental health and substance use disorders and self-harm. And we know that 75% of all mental health disorders occur before the age of 25 years of age. So it's a key time for intervention in a young person's life in terms of their mental health. And mental health is important because it impacts on all aspects of a young person's life, their cognitive, social, and emotional development. We know that young people with mental health difficulties have a greater number of days absent from school, increased risk of self-harm and drug abuse. And there's also studies showing that when we compare a child or an adolescent who has a mental health difficulty and compare them to a child with a physical health condition, that there's a much more long-lasting impact of the mental health condition over the course of that person's life. It has an impact on their ability to earn, their educational attainment, and so on. And many of these mental health difficulties in young people remain untreated, undetected. And the research evidence for early intervention is developing all the time, showing that there is strong evidence that early intervention in this time is really important. And so combined with this being a period of time of heightened vulnerability to mental health difficulties, it's combined, if you think about the young person's life, with numerous transitional events going on and also numerous stressors, highlighting the importance of this period. And while evidence-based treatments for youth mental health difficulties exist, we know that many young people don't get the treatment. So less than 2/3 of those experiencing difficulties will go and access this professional help. So looking at the context of COVID and young people's health, what do we know about it? I suppose at this point, we're starting to accumulate a body of evidence around it. And young people have not all been affected in the same way with regards to COVID. So yes, there's evidence of increases in low mood, hopelessness, loneliness, grief in many young people. Also evidence of increase in mental health disorders, particularly anxiety, depression, and post-traumatic stress disorder. And then a smaller number of young people have actually fared better, talking about increases in happiness and calmness, potentially as a result of having more time at home and less time at school, and some of the stressors linked with school, such as being bullied or exam pressures and so on. But we also know that some groups of young people have been disproportionately affected by the pandemic. We know that young girls and females, young people from social and economic disadvantaged groups, LGBTQI+ young people in residential care. So there are other groups of young people living in low-income families are at increased risk for mental health difficulties during the COVID pandemic. And I suppose what has research shown has been positive or a protective factor for young people in terms of their mental health. What has come up here is that lifestyle and behavioural factors. So young people who reduce their screen time, which was often incredibly difficult as a result of their education being put online, but those who moderated their screen time, who managed to maintain their physical activity, where their parents managed their own emotional distress, and those who maintain good sleep patterns. Some of these lifestyle factors have shown to be linked to better outcomes. Also, young people living in rural regions tended to better in terms of their mental health or having access to outdoor spaces. So this is a snapshot of what we're seeing in terms of the research on COVID and young people's mental health. So the Myworld survey was conducted before COVID. So we collected data on young people from October 2018 up to about May or June 2019. And the value of the Myworld survey is that we're capturing data on young people from 12 to 25 years of age in recognition that this is where we start to see the emergence of many mental health difficulties. And we had a sample of over 19,000 young people. And so an important point to flag with this is that we do see good stability in our data across counties. So I know today that Niki's presented data in the Dun Laoghaire Rathdown area. We tend to see broad stability in our findings across different counties. And a key strength of our research is that we're not just looking at the risk factors. So what are the risk factors that increase a person's likelihood for developing mental health difficulties, but we're also interested in protective factors. And these protective factors really are a broad range of assets, either internal or external factors. So an internal factor could be your optimism, your life satisfaction, or an external factor could be to what extent you have one good adult in your life. But these are assets in a person's life that can help them manage life stresses. And again, we've looked at changes in mental health outcomes from 2012. So we can look to see, are we seeing increases in mental health difficulties? Do we see any of these protective factors increasing over time and so on? We consulted with young people with regards to the refinement of our survey in 2019. And again, highlighting Niki's point, the importance of youth participation. So some key issues that emerge as being really important to look at in our 2019 survey were the importance of measuring sexual orientation appropriately, looking at gender identity, social media, porn use, gambling, a better measure of drug use. So these were some of the ways that we changed the survey from what we had originally captured in 2012, but also a lot of our measures remained the same so that we can look at those changes over time. And our research aims to inform policy and practice in an Irish context. And the research was conducted with Jigsaw, the National Centre for Youth Mental Health. So we collected data from over 10,000 adolescents 12 to 18 years of age. We recruited over 10% of the post-primary schools in Ireland, and our sampling framework is reflective of the national distribution of schools in terms of gender mix, disadvantaged, non-disadvantaged status, having at least one school in every county and so on. And 56% of our sample were female. In young adults 18 to 25 years of age, the majority of young adults came from university settings, followed by institutes of technology, and then we'd have just over a sample of 100 young people who were employed. A key focus of the 2019 research was to capture the voices of young people who are seldom heard. So we had over 600 young people recruited from Youth Reach. So these are young people aged 15 to 20 who are enrolled on the Department of Education's programs for early school leavers. Then we had young people who are enrolled in colleges of further education or community training, followed by a smaller sample of about 50 young people with physical and sensory disabilities. So those who living with deafness, wheelchair users, or a visual impairment. So first of all, I'm going to give a snapshot of depression and anxiety in our sample. And while our report focuses on young people 12 to 25 years of age, we did capture data, particularly amongst those in universities and institutes of technology who are over the age of 25 years of age, up until about 61 years plus. And so what's important to realize with the Myworld survey is that we don't say to a young person, how depressed are you, how anxious are you? We use these standardized measures of depression and anxiety. So for example, with depression, we're tapping into some of those core features such as feeling guilty or feeling worthless. And with anxiety, we're looking at things like their sense of panic or breathlessness. Also, we're looking at cognitive symptoms. So sense of extreme worry and so on. And so using these measures, we can classify people into normal, and normal would suggest low evidence for anxiety or depression, mild, moderate, severe, and very severe. And Niki would have referred to this earlier in her report, where she used a similar measure. She used the same measure. So when we look at the x-axis here, we see we have data from 12 all the way up to 61 years plus. And so the blue here represents depression. And what we're seeing here with depression is that about the age of 14, 15 years, the mean score in depression for young people tends to move into the mild range. It peaks about 18 to 20 years, and then we start to see that linear decrease in depression from 18 years plus. And again, with anxiety here, what we see is that as a cohort from the age of 12, young people are scoring above the cutoff of 7. So as a cohort from 12 years of age, young people are in the mild range for anxiety. And then when they come to 18 years, the mean score in anxiety is now moving into the moderate category up until about 23 years of age. And then we start to see that linear decrease in anxiety. So mirroring the slide that I showed earlier, where we see the peak in the burden of mental health difficulties in young people, here what we're seeing is a peak in symptoms of anxiety and depression occurring typically around the teens and starting to decrease then around the mid-20s. So now moving on to discuss some of the key findings from adolescents. So we asked young people, what are the top stressors in your life? And so what we see here, it's a feature where young people are spending their day, it's exams or homework in school. And then we asked them, well, what are the top 3 coping strategies that help you when things are difficult in your life? And so it's their friends, followed by music and sports or exercise, followed then by sleep. And so using the standardized measure of depression, what we see here is that about 60% are in the normal range, so showing low evidence for depression. This means that about 40% are outside the normal range, where we're seeing that about 15% of our adolescents are in the severe and very severe category. And we see that more females are likely to be in the severe and very severe category for depression. And what we see is depression increases across the school year. So from 1st to 6th year, we see more young people fall out of that normal range for depression. With anxiety then, we see that even more young people are falling outside of the normal range. So about 50% of young people are in the normal range for anxiety. And then what we see is that particularly pronounced amongst females falling into that severe, very severe category. So in adolescents, 12 to 18 years, we see that nearly 1 in 3 females are falling into that severe, very severe category for anxiety. Again, anxiety increases across the school year. So for the first time in 2019, we asked young people about their suicidal thoughts and behaviours. And what we see is that about 40% had thought about taking their own life, even though they wouldn't do it. And this is more pronounced amongst females and those in the senior cycle. We also asked about non-deliberate self-harm. So this is, have you ever thought about have you ever deliberately hurt yourself without wanting to take your own life? And the National Suicide Research Foundation has done some research looking at young people's motives for this. And often it's the interpersonal factors, such as an unbearable psychological pain or an inability to tolerate distress. So we see that about 1 in 5 young people are reporting that they had ever deliberately hurt themselves without wanting to take their own life. Again, this is more common amongst females and those in the senior cycle. And about 6% reported a suicide attempt. About most of that is occurring within the past year, but we don't see gender or school cycle differences here. And then we asked young people, well, did you seek support? And if you did, how helpful did you find it? So what we see is that less than half reported that they accessed support or help. And then for those who did go and seek the help, we can see that many young people are finding it difficult. So 40% found it difficult or very difficult. But most young people who do go seek the help and get help do find that it's at least somewhat helpful. So 90% are saying, well, if I did get support after a suicide attempt, I found it helpful. And we asked them, where do they go and seek that? It's really mixed between both formal and informal. So they might say their friends, their parents, they might say psychologists, psychiatrists, A&E, and so on. And so we see that those who've made a suicide attempt are scoring significantly higher in risk factors and lower in protective factors. And we see the same pattern again for self-harm. So for example, those who made a suicide attempt have higher depression, anxiety, higher problematic drinking and drug use, and then lower levels of some of those resilience factors such as school connectedness, optimism, and so on. In adolescents, we're very interested in this measure of school connectedness, and this is to what extent young people say they enjoy school, that they like being at school, that they feel part of their school. And those who have higher levels of school connectedness, they had lower levels of depression, anxiety, they're scoring higher on protective factors, they're much more likely to talk about their problems, they're also more likely to talk about their problems or seek information about mental health from their teacher or guidance counselor in the school, they're less likely to be absent from school, less likely to be bullied in school, have more connectedness with their peers and more likely to be satisfied with school. So we do see school connectedness as an important protective factor in adolescence. So moving on then to talk about some of the findings amongst young adults, what we see here is the top stressors are college, the future and finance. And Niki referred earlier to the future. And we did consultations back with young people to say, well, what is it about the future? Is it global issues? Is it personal concerns? And what they said is that, look, it is mainly personal concerns like money and their futures and jobs, but also global issues like climate change, economic uncertainty, political upheaval, and so on. And another stressor for young people that came out, particularly amongst those in third level institutions, was this, feeling incredibly stressed to work outside of the college environment. So to also, I suppose, fund themselves potentially while they're trying to pursue their college studies. And so the top ways of coping for young people were their friends, sleeping, and music. Again, we take young adults, what we see here is that even more significant than the adolescents, what we see is that about 60% are falling outside of the normal range for anxiety, and females have higher levels of anxiety than males. And I suppose when we use a matched sample and look at our Myworld survey 1 data and our levels of anxiety, and then compare it to our Myworld survey 2 data, what we see is that there was an increase such that 15% of our sample back in 2012 were in the severe and very severe categories for anxiety. This had now increased to 26%. And we see this internationally as well. So our finding mirrors what we see internationally. And we see a similar pattern again for depression. Young people in Myworld survey 2 much more likely to fall into the severe, very severe categories for depression. One positive finding here is that we see that more young people in Myworld survey 2 report that they don't drink alcohol. And we used a standardized measure of alcohol, which looks at more than just frequency and quantity of drinking, but also looks at the behavioral consequences. So have you been injured? Have you not been able to get up as a result of your drinking or perform as normal? And so unfortunately, we can categorize people into the lowest drinking category, problem, hazardous, or possible alcohol dependence. And we see that males are more likely to fall into the problem, hazardous, or possible alcohol dependence category. And we see since the first Myworld survey that there has been a decrease in the percentage who reported drinking at all, drinking weekly, and there's also been a decrease in risky alcohol behaviour. So these are some positive findings with the standardised measure of alcohol that we looked at. And when we make that link between alcohol and mental health, what we find here is there's a strong link. So those who are in the hazardous or possible alcohol dependence categories in terms of their drinking are falling into the severe and very severe categories for anxiety. And we see a similar pattern for depression. And I suppose the concern here is that if we look back here and see the hazardous drinking category, so it's about 8% overall, that other studies have shown that only about 25% of young people actually realize that they're engaging in this type of hazardous drinking. So many young people who are engaging in a hazardous pattern, which has shown to have damaging consequences to both their physical and mental health, are actually aware of it. With our measure of drug use, we see that about 53% had smoked cannabis in their lifetime. It's typically occurring 15 to 19 years of age. It's higher amongst females than males. We also see that our youth reach sample, so the early school leavers, are much more likely to have engaged in drug use. And about 40% said that they'd used drugs other than those required for medical purposes. And then using our standardized drug measure, we see that about 14% are falling into that moderate to severe category again, more higher amongst females or males than females. And again, we see that relationship between drug use and increased levels of anxiety and depression. And also important to highlight here is that polysubstance use, we see evidence that those who are in the more risk categories for drug use are also much more likely to be engaging in higher risk drinking and so on. When it comes to help seeking, we find a similar pattern to Niki's findings. So we see that it's the informal sources of support for young adults, their friends, their parents online, and the formal sources then, the top ones were the psychologist, the therapist, the counsellor, student counselling services and GP. Interestingly, one of the lowest uses of formal support was the phone helpline. And so with our research, a key focus was the one good adult. And this was highly promoted back in 2012 with the research on it. And what we see is that overall, most young people do report high levels of support. They're scoring above the midpoint on social support from their family, their friends, and a significant adult in their life. So here in Myworld Survey 2, we saw an increase in the percentage of young people reporting one good adult in their lives. So it went from 71% to 76%. And we asked them, well, who is this one good adult? And for young adults, it's their friends, their partners, their romantic partners, followed by their parents or multiple sources. And then some other people didn't specify. But we see that the one good adult is linked to better resilience, better connectedness, better mental health in terms of lower depression and anxiety, so higher life satisfaction. So we do see this strong relationship between having one good adult in your life, higher protective factors and lower risk factors. And again, the one good adult changed depending on whether the person was a young adult or depending on whether they were an adolescent. So just very quickly, I'll allude to some of the changes from the Myworld Survey 1 to 2. In line with international research, we do see, and these are adolescent findings, an increase in the percentage of adolescents who are reporting severe, very severe depression. So it went from 8% in 2012 to 15% in Myworld Survey 2. Again, more significant were the increase in anxiety, particularly amongst females, going from 11% in the severe, very severe categories in 2012 up to 22% in Myworld Survey 2. A positive finding is that more adolescents report not drinking. But the issue here is that for the adolescents who are drinking, they're much more likely to fall into those risk categories. And that would also mirror what we're seeing with other Irish and international research. In terms of the key risk and protective factors, the green here would highlight some strengths. So we see that young people report an increase in problem-focused coping. We see more males likely to seek support when coping with difficulties. There was an increase in perceived support from those around them, and also an increase in one good adult. We also saw a weakening of some of those protective factors such as resilience, optimism, self-esteem, school connectedness, and life satisfaction. And then looking at young adults, some positive findings, again, an increase in one good adult, a decrease in bullying, a decrease in financial stress when the first Myworld survey would have been conducted back in the recession, a decrease in high-risk drinking, and also more young adults likely to talk to their families about their problems. But combined with that, we do see a weakening of protective factors such as self-esteem, optimism, problem-focused coping, and lower levels of friend support. So just trying to synthesize some of the key findings of the Myworld research, I suppose it's important to realize that for many young people, the one good adult wasn't someone in their family. And in that case, it's important that we can consider in what way we can be that support for young people. About 10% of young people say that they have low or very low support from one good adult. So that collective responsibility in terms of supporting young people, where we see that relationship between having one good adult is linked with better outcomes in terms of their mental health. And so we know that young people are going to go through difficult times. They're exposed to stressors, that's part of life. So it's important to consider what way we can equip young people to navigate through difficulties in their lives. So we see here that promotion of positive coping strategies is important. Can we build resilience? Can we be one good adult to show them that we're there for them? We also would see strong relationships between lifestyle factors, those who are engaging in physical activity, better sleep, volunteering, have hobbies and so on, reduce screen time, are showing better outcomes in terms of their mental health. And then I suppose the concerning finding is for those who need more intense support, particularly, for example, those who had made an attempt to take their life, that they were still finding it difficult to get access to support, even though most people found it helpful at that point. So it's about signposting young people to the right supports, being aware about the supports that are available there, and that crucial importance of getting the right support at the right time is really important. So these are quotes from some young people who took part in our research. The first here is that people sometimes feel uncomfortable talking about mental health, and that's okay, but it's so important that everyone understands what mental health is and how to feel good in your life and feel positively. And the second quote is from a young adult. I suffered greatly in the past by mental health, and I was extremely lucky to family support and access to mental health supports. I hope that one day the services I was lucky to interact with will be available to everyone, not just those lucky enough to have services close to them or be able to afford them. Great, so I leave it